This is English shorthand dictation number 45 and the dictation speed is 150 words per minute. Ready? Start. The health of individuals is their most important asset. The World Health Organization states that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction based on race, religion, political belief, economic or social condition. Health is a matter of human rights and its violation should be seen as a violation of human rights. Therefore, it is crucial that the state plays an active role in providing health care to the people. When we think of a healthy person, the first thing that comes to mind is that of a person who is physically fit and free from illness. However, health is not just confined to physical fitness but also means mental well-being. A person who is free from any fear or anxiety is seen as a healthy person. The WHO defines health as a state of complete physical, mental, and social well-being and not merely an absence of disease or infirmity. In recent years, health is also seen as the ability to lead a socially and economically productive life. In order to attain total health, factors like availability of nutritional food, clean drinking water, and an environment devoid of pollutants also play a key role. Healthcare resources in India are ample. There has been a definite growth in the overall healthcare resources and health-related manpower in the last decade. The number of hospitals has almost doubled from 1991 to 2000. During the same period, the percentage of private hospitals has increased considerably. In 2000, the country had 1.25 million doctors and 0.8 million nurses. This means that there is one doctor for every 1,800 people. Approximately 15,000 new graduate doctors and 5,000 postgraduate doctors are trained every year. The country has the capability of serving people across thousands of villages. The country has an annual production of medicines worth rupees 260 billion. Advancement in medical technology has led to better treatments and procedure. A number of medical tourists also come to India for treatment because of the excellence in medical service that is available at low costs. However, the healthcare sector seems to be lagging behind in rural India. The ratio of hospital beds to population in rural India is 15 times lower than that in urban areas. The number of doctors in rural areas is almost 6 times less than that in the urban population. Per capita expenditure on public health is 7 times less in rural areas compared to government health spending for urban areas. At present, infectious and parasitic diseases dominate. Tuberculosis causes a large number of deaths in India. Every year, scores of children in the rural areas die of measles and malnutrition. About 21% of communicable diseases are waterborne, like diarrhea, hepatitis, etc. Despite having the knowledge, expertise, and other resources, we are unable to provide healthcare facilities to all. For a healthy life and care during illness, there is the need of appropriate healthcare services like hospitals, health centers, laboratories, ambulances, and blood bank. We also need well-trained doctors, nurses, health workers, and paramedics to diagnose and treat the illnesses. Besides this, medical equipment, machinery, and medicines are needed for treating the patients. Making such resources available is the responsibility of the government. The healthcare services in India are provided in two ways: public health services and private health services. The government is responsible for providing public health services both in rural and urban India. The government establishes hospitals and health care centers across the country which are equipped to provide treatment for all kinds of illness. Our public healthcare policy envisages a three-tier structure comprising the primary, secondary, and tertiary healthcare facilities to bring these services within the reach of the people. The primary tier is designed to have three types of healthcare institutions, namely a sub-center for a population of 5,000, a primary health center for 20,000 to 30,000 people, and a community health center as a referral center for every 4 primary health centers, covering a population of almost 1.2 lakhs. The health centers in the villages are handled by trained nurses and a village health worker. They all work under the supervision of primary health center doctors. The district hospitals function as a secondary tier for the rural health care and as the primary tier for the urban population. They supervise the rural health centers. The tertiary tier health care is provided by health care institutions in urban areas which are well equipped with sophisticated diagnostic and investigative facilities. In pursuance of this policy, a vast network of healthcare institutions has been created, both in the rural and urban areas. Substantial resources have gone into planning and implementing the health and family welfare programs. Public health services are called so because they are meant for all the citizens of the country, be it in rural or urban areas. They provide healthcare facility either free of cost or at low rates to the poor. The construction of these hospitals and healthcare centers is done through the money that the public pays in the form of taxes. They require medical equipment and medicines are also funded by the government. Prevention of diseases like tuberculosis, malaria, jaundice and cholera is also part of public health. The Universal Immunization Program is also an initiative taken by the government to provide vaccination to prevent diseases such as polio, measles, diphtheria and others. The Constitution clearly states that the welfare of the people and providing them healthcare facilities is the primary liability of the government. Private health services are offered by individuals and are profit-oriented. Private healthcare facilities include laboratories with all kinds of new equipments to provide facilities for diagnosis such as X-ray, ultrasounds, blood tests, etc. Several doctors have set up their own private clinics in the urban and rural areas. The number of such private practitioners is more in urban areas than in rural areas. The infrastructure in the private health services is much better than the public one. In fact, the private sector, despite being costlier, provides 80% of the health services in the country. In recent times, private healthcare facilities have been established in every nook and corner of the country. Many hospitals offer superior treatment and facilities and charge hefty amount of money for their services. Medicines are also sold at several private shops which are costlier than the ones that are available at government dispensaries. This has resulted in big private companies investing in manufacturing and marketing of medicines. In the absence of adequate public health care facilities, the growth of private healthcare sector has been largely seen as a boon, but in reality it has created stark social and economic differences. The private healthcare sector is driven by profits and is therefore very expensive. This limits the access to private healthcare facilities for people from the economically weaker sections of the society. The increasing cost of healthcare and medicines is making healthcare unaffordable for a growing number of people. Universal access to healthcare is a norm in most of the developed countries and some developing countries like Cuba, Thailand and others. In India, the inequality in the healthcare provisions is further enhanced by difficulties in accessing it. People in remote areas with little transport facilities cannot dream of being given prompt medical treatment in times of illness. There is not only a paucity of doctors and nurses in such remote areas, but also traveling vast distances to reach a healthcare centers is not possible for many poor people. In some areas, the state government has made provisions for a mobile dispensary for the poor in the country. Since the very basic facilities of water, nutrition, sanitation and housing are missing, they tend to fall ill more frequently. Each illness brings more distress and anxiety to them as money has to be spent on health care. Further, women also face inequality in health services. Often the health of women is considered less important than the male members of the family. Health standards of a country reflect the social, economic, political and moral well-being of its citizens. Economic and social growth of a society and country is directly dependent on the health of its citizens. Hence, it is important that healthy living conditions and access to good quality health care is provided by the government. It is not only a basic human right but also a prerequisite for the social and economic development. Our current healthcare system lags behind in meeting the healthcare needs of the people. It should be made accessible to all. However, health is as much about the health healthcare facilities as about the social and economic conditions of the people. Therefore, both need to be worked upon simultaneously to be able to achieve the goal of providing healthcare facilities to all. The government and the private services as well as the people have to come together. We can understand it from two examples. In 2018, Ayushman Bharat Yojana, world's largest healthcare scheme, was launched by the central government.